Dentists encourage us to visit them regularly. That same rule sometimes applies to our pets. Mainely Veterinary Dentistry in Windham is believed to be the only clinic in the state specializing in oral care for pets. The team is using a new piece of equipment and gave Samantha a closer look at the technology.
This is the first cone beam CT in the state of Maine, so that's pretty awesome.
Who in this? Is that a Frenchie?
Frenchie, It's a little bit different than traditional CT in that it's mobile, so we can bring it right to the table, right to the patient. We don't have to have a designated room for it.
Good girl.
So it's a lot easier to use. And it's also better for identifying dental disease, so it's a game changer for us.
Yeah.
We get them under anesthesia first. As soon as they're stable, asleep enough, we position them, we get the CT, because it tells us what we need to do. So first thing we do is get the CT.
I'm gonna take a scout. Shooting.
And then we're going to roll the CT away from the patient. I'm going to read the images while the technicians are repositioning the patient. The technicians also start probing the teeth, just like at your dentist. They look for pockets, 2, 2, 2, 3, 3, 3. We do the same thing. So while I'm reading the images, they're going to do an oral exam, and we combine those two pieces of information to make a treatment plan. And then I do nerve blocks, so their mouth can start to get numb in the areas that need to be numb, and then they're going to clean the teeth, and then I'm going to do oral surgery. Yeah, that unfortunately does have a fractured tooth, so she will need one extraction today. Traditional X-ray, we were getting, 10 to 20 X-rays that take us anywhere from 5 to 20 minutes to get, depending on how big the patient is. And we're only getting two-dimensional imaging, and we're going through a lot of bone in that image. Whereas this, we're getting 0.3 millimeter slices, 600 X-rays in 20 seconds. So that's a ton more data, ton more information, not only on the teeth, but also we can look at the nasal cavity, the ears. Animals can't talk to us, right? So they can't tell us when something's wrong. And we've had this machine for a couple months now, and we've already identified numerous cases of ear disease that the owner had no idea, or didn't know that it was a middle ear infection, not just an external ear infection. We had a cat this morning that has stomatitis, and it's really important that with stomatitis cats, once they have all their teeth out, that we don't leave any root tips in there. And there was a root tip in there that I could not see on X-ray. We took an X-ray of it, and I totally would have missed it, and I saw it on CT. So this is a scan of the Frenchie. We've got 3 views here. So we get kind of a top down, so looking from here down through the jaw. Really important here because, like I said, this is all that thick bone that I mentioned. So we can get multiple views through this thick bone. And then this is an image from the nose back, so then we can scan through all of those slices, all of those X-rays that we got from the nose back. We can see the nasal cavity really well. So this is the front. Now we're scanning towards the back of the head. This is the periorbital area. So this is where the eyes are. I'm scrolling back. We get all the way back here. This is the TMJ. So we get the TMJ joint we can look at, make sure that looks okay. And then we get all the way back to the ears. And then we get the side-to-side view. So this is the traditional kind of view that we would get with regular X-ray, except for we get multiple 0.3 millimeter slices, so we get a lot more of them on a side-to-side view, so we can really evaluate bone loss here on a side-to-side view. And again, for a Frenchie, this isn't really looking too bad, so might not have to have a lot of extractions today, just a really thorough, deep clean. The other super cool thing is we can reconstruct all of this data into a 3-dimensional image. This is really helpful, one, for owners to see better, because sometimes an X-ray is hard for them to interpret, but we can show them this and they can see a little bit better on what we're talking about. Oftentimes we get some bone loss back here in these molars. We do have a little bit of bone loss here where the bone's recessed from the crown, so they can see that a lot better. For us, this image is really helpful for jaw fractures. One hard part about being a veterinarian is we not only, we have to advocate for the animals because the owners don't always understand. So we need to, really do a ton of education, which is actually a part that I love about my job. So this helps us do that education and really advocate for our patients.
Dr. Keaton is the only veterinarian north of Massachusetts using this piece of equipment. It's so sophisticated it can even detect cancer. By the way, the price tag on this piece of machinery, $250,000. We've got more on how this device is changing the way pets are cared for on our new Center Maine website and app.